Hi, Mike Gibson coming to you live from SCAI 2018, and I'm joined by Sahil Khera. Welcome, Sahil, to the show.
Thank you, Mike.
Talk to us about what you just presented, which is a 30-day risk score for TAVR patients. First of all, tell us what kind of TAVR patients and what you found.
No, great. Thank you for having me here. So we devised, as you know, 15 to 20% of patients are readmitted within 30 days after a TAVI procedure. And as more and more patients, get TAVI, I think this has become really important for us for a couple of reasons. One is obviously for quality of life. Second is the economics of the whole procedure and the cost of the implications of it to the healthcare system. So what we did was we used the nationwide readmissions database and extracted data from January 2013 to 2015 and had 19,000 patients who underwent a TAVI procedure. Out of these, 16.2% of patients had a 30-day readmission, and we made a risk score that had 9 variables. 2 of them were post-procedural variables, which were acute kidney injury and length of stay more than 5 days. One was the discharge status, whether they were sent home or skilled nursing facility. And the other were baseline clinical comorbidities: chronic lung disease, chronic liver disease, anemia, end-stage renal disease on dialysis, and chronic kidney disease not on dialysis.
Now, listening to this list, I don't see anything on there that I can modify as an operator.
Absolutely. Yeah. And I think that's an important observation. And interestingly, someone asked me, so with this risk score, if the risk is high, are you going to deny a procedure to someone? And I said, well, you can't really deny a procedure because 3 out of these variables are post-procedural variables. However, we need a score like this to sort of help the transition of care. When these patients go home, you have to make sure whether, okay, so this is a higher risk patient, I'm going to have an earlier follow-up. I'm going to make sure the primary care provider knows about it. I can have a telephonic conversation, have a visiting nurse services, or, send the patient to a rehab facility, if you will. I think the score will give us an indicator that, hey, this patient's a higher risk for readmission, for a possible poorer quality of life if he or she keeps getting readmitted. How can we better this? How can we prevent this? So I think this is the first time we try to come up with a score for 30-day readmissions after a TAVI procedure.
It also could be useful in risk adjustment and models, right?
Potentially, yes. The only issue is we want to first validate it externally to make sure how it stays, especially with the lower risk TAVI patients we're doing now, intermediate to lower risk, because the data ends at 2015, which is still higher prohibitive, if you will.
Sure.
And now we have more of the intermediate risk category. So we just want to make sure that it holds its ground in the modern day TAVI population as well.
Great work, Sahil. Congratulations.
No, thank you so much.
And thanks for presenting it here. And thanks to all of you for joining us here live from SCAI 2018.